Good afternoon. I am Dr. Lefa Eddy. I'm a child and adolescent psychiatrist. I began as a pediatrician, but later specialized in psychiatry. And now it's over 20 years that I am working with children and teenagers and young adults with ADHD. I work in Spain. So I am going to talk about our guidelines here in Spain. We have two ADHD guidelines. One is from 2010, which approaches the management, but also the assessment of ADHD. And later in 2018, there's a new guideline, but it only talks about the management, but not the assessment. We consider, as in all countries, I imagine, that ADHD is a clinical diagnosis, so the interview is essential. By means of the interview, we reach the diagnosis. We use questionnaires, of course, for the parents, which help us make sure that all the items of DSM-5 are aborted. And we use the questionnaires for teachers to get the information in that other situation, not only at home, but also at school, where there are quite a lot of hours a day. With all this information and the interview and seeing the child or the adolescent, we reach the diagnosis. So I insist what we consider most important is the interview. Of course, there's psychological assessments that you can do, and they're very useful, but we don't consider that they are essential. It's very good to be able to have an IQ, to know his working memory, to know his attentional span, to know the executive functions, how it works in the kid. But as I said, we don't consider it essential. Also, I've been asked to talk about the treatment. Well, before talking of the treatment, I would like to say that pediatricians at age 6 and 8 usually screen for ADHD. So that helps a lot for the kids to reach mental health. And also at school, teachers have their own protocol to help them be able to do a first assessment when they see learning difficulties and when they see behavior difficulties. And if their screening is positive, then they send them to mental health, to the psychiatrist for a complete evaluation or assessment. As I said before, I have also been asked to talk about the treatment. In kids below age 6, we usually don't use medication. We just recommend therapy, cognitive behavior therapy or family therapy, using the recommendations of Professor Barkley or the PPP, I can't remember now, the Positive Parenting Program and the Incredible Years Program, etc. After age 6, we like to use both, continue with the therapy, of course, the psychological therapy, but also include the pharmacological therapy with psychostimulants, basically methylphenidate. If in first place, if it doesn't work well, then we usually try lisdexamfetamine. I'm not sure my pronunciation of the pharmacs, of the medications, is totally correct. I hope it's possible to understand the medications that I mentioned. And if they don't work well, we use in second place atomoxetine and guanfacine. And it also depends a lot the comorbidity that the kid might have, that we decide on one or other medication, of course. Usually it's a psychiatrist who gives the medication, but sometimes pediatrician, if it's a ADHD without comorbidity or just learning disability that accompanies it, sometimes the pediatrician takes care of the medication also. But the rest of the cases, if there's comorbidity, which is the most, about 80% have comorbidity, it's always in mental health where the kids are attended. I think I've mentioned everything that I was asked to talk about, and I hope it's been understandable. It has been a pleasure. Good evening.